Hello, my name is Veronica, and thank you for watching my research presentation. Today, I will be presenting information regarding oral microbiology and the human oral microbiome. Here is a list of things to expect while reviewing my research presentation. By the end of this video, you should understand the human oral microbiome, understand the normal flora of the oral cavity, understand the meaning of dysbiosis, learn different types of oral health conditions, and learn how to maintain proper dental hygiene. What is oral microbiology? Oral microbiology is the study of how oral microorganisms interact with their human host, primarily in the oral cavity. Essentially, the maturity of these microorganisms is connected to the state of our oral health and physiology. Thus, while the oral microbiome is vast and complex, it is crucial to know its role in our oral health. The oral cavity is the most complex and most accessible microbial ecosystem of the human body, consisting of the teeth, gums, tongue, throat, and cheeks. Our mouths host the body's second most diverse microbial community. The oral microbial community structure is so diverse that the human mouth is home to more than 700 various species of bacteria located within the oral mucosa soft tissue and our teeth. Several of these bacteria are associated with dental plaque. At healthy oral sites, just 34 to 72 species are discoverable within individual humans. Some are probiotics that are beneficial to one's well-being. However, there is a tendency for more significant numbers of different species to be present at diseased oral sites, perhaps 200 or more. Overall, the mouth is an incredibly colonized part of the body, and one's oral health has a vital influence on their general health. Normal bacterial flora of the oral cavity. The presence of nutrients, epithelial debris, and secretions makes the mouth a favorable habitat for several bacteria. Oral bacteria include streptococci, lactobacilli, staphylococci, and corneobacterium, with many anaerobes, especially bacteriodes. The mouth presents a sequence of different ecological positions with age, which corresponds with changes in the production of the normal flora. At birth, the oral cavity is composed entirely of the soft tissues of the lips, cheeks, tongue, and palate, which are kept moist by the secretions of the salivary glands. At birth, the oral cavity is sterile. However, it rapidly becomes colonized from the environment, particularly from the mother in the first feeding. Streptococcus salivarius is dominant and may make up 98% of the total oral flora until the appearance of the teeth, which usually occurs around 6 to 9 months of age. The eruption of the teeth during the first year leads to colonization by S. mutans and S. sanguis. Other strains of streptococci adhere firmly to the gums and cheeks, but not to the teeth. The creation of the gingival crevice area increases the habitat for various anaerobic species found. The normal bacterial flora of the oral cavity benefit from their host, who provides nutrients and habitat. Normal bacteria also provide benefits to the host. The normal flora occupies open colonization sites, making it more difficult for other microorganisms to become established. Also, the oral flora contributes to host nutrition through the synthesis of vitamins. In addition, they contribute to immunity by inducing low levels of circulating and secretory antibodies that may cross-react with pathogens. Finally, the oral bacteria use microbial hostility against non-indigenous species through producing inhibitory substances such as fatty acids, peroxides, and bacteriocins. The oral flora is the usual cause of various oral diseases. Some diseases are abscesses, dental caries, gingivitis, and periodontal disease. Suppose oral bacteria can gain entrance into deeper tissues. In that case, they may cause abscesses of the alveolar bone, lung, brain, or extremities. If oral streptococci are introduced into wounds created by dental manipulation or treatment, they may adhere to heart valves and initiate subacute bacterial endocarditis. Oral health conditions. The human body is full of colonies of harmless bacteria known as microbiota. Most of these bacteria positively affect overall health and contribute to the body's natural processes. However, when one of these bacterial colonies is out of balance, it can lead to dysbiosis. Dysbiosis is where bacteria can manifest and disrupt the oral ecosystem, resulting in oral diseases and conditions like periodontitis, cavities, and gingivitis. In particular, dysbiosis can be caused by poor oral hygiene, smoking, diet, health conditions such as diabetes, and even genetic differences. In 2016, there were nearly 45,000 new cancer cases of the oral cavity and pharynx diagnosed in the United States and more than 10,000 deaths. The 5-year survival rate for these cancers is about 61%. Unfortunately, the mortality rate from oral cancer is nearly 3 times as high in males as it is in females, and nearly twice as high in white and black populations as it is in Hispanic population. Preventing high-risk behaviors that include cigarette, cigar, or pipe smoking, smokeless tobacco, and excessive alcohol use are critical in preventing oral cancers. Early detection is key to increasing the survival rate of these cancers. Cavities are caused when acid produced by bacteria breaks down the tooth enamel, which is found in plaque that collects on the teeth, especially around the gum line and in the crevices on the chewing surfaces of the teeth. Eating and drinking foods high in carbohydrates create bacteria to generate the acids that can cause the outer coating of the tooth or root surface to break down. Although cavities are largely preventable, they are one of the most common chronic diseases throughout the lifespan. Untreated tooth decay can lead to an abscess under the gums, which can spread to other parts of the body and have serious and, in rare cases, fatal results. Community water fluoridation and school-based dental sealant programs are both cost-saving, proven strategies to prevent tooth decay. Gum disease is mainly the result of infections and inflammation of the gums and bones surrounding and supporting the teeth. Certain chronic conditions increase one's risk for periodontal disease, including diabetes and weakened immune system, poor oral health, and heredity. Tobacco use is also a significant risk factor for gum disease. Suppose early forms of periodontal diseases are left untreated. In that case, the bone that supports the teeth can be lost and the gums can become infected. Teeth with little bone support can become loose and may eventually have to be extracted. Gingivitis is a non-destructive type of periodontal disease, but untreated gingivitis can progress to periodontitis. This is more serious and can eventually lead to loss of teeth. Gingivitis is a common type of periodontal disease. Signs of gingivitis include red and puffy gums that bleed easily when the person brushes their teeth. Gingivitis also resolves with good oral hygiene, such as more prolonged or more frequent brushing and flossing. In addition, an antiseptic mouthwash may help. In mild cases of gingivitis, patients may not even know they have it because symptoms are mild. However, the condition should be taken seriously and addressed immediately. How to maintain proper dental hygiene. I'm going to give you tips on how to brush your teeth the right way. First, gently brush your teeth on all sides with a soft bristle brush and fluoride toothpaste. Use small circular motions and short back and forth strokes. Don't forget to brush carefully and gently along the gum line. Then, lightly brush your tongue or use a tongue scraper to help keep your tongue clean. Finally, clean between your teeth with dental floss, a water flosser, or a similar product. Doing so removes plaque and leftover food that a toothbrush cannot reach. Rinse after flossing with fluoride, and that's how you properly brush your teeth. Cut out the sugar. Sugar is a primary culprit in tooth decay. It fuels bacteria and acidity in the mouth, causing plaque to form and eat away at teeth enamel and gums. To avoid being among the 20% of people in the United States who face tooth decay, try to cut down on sugary treats and strive to brush and floss after every meal or snack. The nicotine and tar in cigarettes not only turn teeth an unsightly shade of yellow, but they also eat away at the gums. Smoking creates a prime environment for bacteria and plaque on teeth and along the gum line. That harms tissue, degrades the bone that supports teeth, and eventually increases the risk of tooth loss. While it's true that visiting the dentist twice a year is a good rule of thumb for many people, the truth is that everyone has unique smile needs. So it depends on the person's oral hygiene, habits, and individual medical conditions. Some people only need to visit the dentist once or twice a year, while others may need to go more frequently. So always remember to ask the dentist when an appropriate time to schedule a visit should be. This is the end of my presentation. Thank you so much for listening, and I hope you learned a little about oral microbiology and what is in our mouths.